title of today's event is called Conversation about Diversity and Health Equity. This is the first ever APA event, and all of them asked for an open, free dialogue, a safe environment to talk about diversity issues that are important to them and to their patients. And I thought that was a brilliant idea, and for me as a new director, why not use this as an opportunity for all of us as APA members to reimagine what diversity could mean for them.
I serve as the Chief Diversity Officer for the Association of American Medical Colleges, but for the last 20 years I've been in academic medicine, and in each role that I've had in academic medicine I've had specific responsibility around trying to diversify the nation's medical schools and teaching hospitals.
I think some of the highlights for today will probably include workforce diversity, which more broadly means how do we attract more people into psychiatry, particularly people of underrepresented backgrounds. I also think education will come up, cross-cultural competency, and I prefer the term cultural sensitivity and humility. As we start to see more and more people accessing healthcare, and hopefully more and more people accessing mental health care, I think the patient demographics are going to change for all of us, and we're going to have to start thinking about how do we provide equitable care for everyone.
I think the barriers are pretty clear and well-founded, and we've known about them for decades now. Our pipeline of talent is much too small. Diverse talent is much too small across the world, really, but certainly in the United States, we really have struggled to increase opportunity for minority youth primarily. The opportunity is primarily in the United States has been brought upon by healthcare reform. The idea that we can think differently about how we remunerate a physician, moving from a volume-based system to a value-based system, allows us to think about the role diversity and inclusion plays in adding value to the patient encounter. We're in a unique moment in time where the diversity and inclusion efforts can move from simply being something that's viewed as important to being recognized as something that's urgent and something that can be leveraged to really help us achieve what we really want to achieve, which is better health outcomes for all Americans.